behalf of the pharmacists and our patients throughout the state, we thank you for being here today as we start a new era in pharmacy. We have a lot of speakers, so we'll get right to it. And first, I want to thank our House sponsor, Representative Greg Harris from Chicago.
Good afternoon. And I'm here today not only as a representative from the city of Chicago, but also a state representative that represents, every corner of the state, from Chicago to Cairo, east to west. And in all parts of our state, we're seeing some real problems in the area of pharmacy. We're seeing local businesses and independently owned pharmacies being driven out of business by unfair trade practices. And we see the cost of prescription drugs skyrocketing for families and kids who are counting on those drugs in our community. And I just broke somebody's microphone. So we're here today to work on legislation that will outlaw predatory pricing practices, that will stop insurers and PBMs from disadvantaging local pharmacies and local pharmacists, and to make drugs more affordable to families and consumers across the state of Illinois. And I see my co-sponsor just coming down from a meeting from the governor. Ladies and gentlemen, Senator Andy Manar, co-sponsor. So working together from both the perspective of Chicago and downstate, we're talking about this being a bill of statewide importance. It's important to every family. It's important to our business communities. It keeps income in our communities, keeps better health for our families. We're so glad you're here today as pharmacists who understand the harms and the detriments that these practices have had on folks who are suffering and folks who are just trying to get their families well and better. Thank you for being here. And now it's my honor to announce my Senate co-sponsor, Senator Andy Manar from Bunker Hill, Illinois.
Thank you all. Thank you all for being here. First of all, I want to thank Representative Harris for his work that has spanned years on making health care more affordable, not just to his constituents, but to everyone around the state. And in this case, this is a pretty simple question that we have to take to our colleagues, and we're going to rely on you all to help us do this. Is it right for PBMs to use business practices to put their competitors out of business? Is that right or wrong? We know it's wrong. We know it's wrong. Yes. I happen to like my pharmacist. And Michelle is right back there. I see her holding her hand out. And she invested in a rural community that didn't have a pharmacist, where individuals, my neighbors, had to drive miles to get a prescription filled. And she stepped forward and she invested in my small town. And I know that people in the Rotunda today have done that for years, investing in your communities where you live, delivering health care. All of that is threatened today in so many parts of the state. And the point of this bill, with Leader Harris's leadership in the House, is to say enough is enough. We are fed up with the business practices of PBMs, and it's time to end it in Illinois once and for all. So we're just asking for a level playing field, and with your help and your continued advocacy, I'm confident that we can get the job done. Today is day one. It's an important day, and we're going to see this through this session, and we're going to get co-sponsors, Democrats and Republicans, working together to make sure this happens, because I want more people like Michelle investing in communities all around the state. And the only way that's going to happen is if we get this bill passed. So thank you for your advocacy.
Thank you. Now I'd like to have Ben Calcaterra, who's past president of the Illinois Pharmacists Association, for a couple comments.
Thank you, Garth. Hello, my name is Ben Calcaterra. I am a pharmacist from the far rural southern Illinois. I'm a second-generation pharmacist with 3 pharmacies dating back 40 years. When I graduated and started managing our stores, we were not financially hindered by adding pharmacists, technicians, support staff, or even new technology for the betterment of our business and the safety of our patients. We were not guessing at how much reimbursement would be clawed back months later without warning. We were not having our own patients stolen from us by the very plans we were billing for their prescription services. We were not worried about being audited for minuscule clerical errors, devoid of any fraud, waste, or abuse. But we do not live in the past. We are healthcare professionals first, but we also must run a sustainable business to keep our doors open and accessible to our patients. Today, we have to fight for every single dollar of profit. We have to fight to find funds, to hire staff, just to wait on our customers, and to purchase technology to keep up with a growing list of best practices and regulations. Today, we could make a $20 profit on a claim and have $30 reclaimed months later, making it impossible to reconcile our books. Today, our patients could be charged that same $20 by PBMs when we would have charged only $10. And who would have thought, as healthcare professionals, we could be muzzled from explaining those payment options to our own patients? Today, I have received 20 audits since the beginning of this year for no other reason than retaliation for speaking out against these very tactics. Every script we fill, we worry more about PBM auditing that claim than from our own Board of Pharmacy inspecting our practices. Today, the PBMs have too much power. Today, the PBMs are profiteering off the backs of our patients in our state. Today, the PBMs are in business of wealth instead of health. Today, the new fight begins. Today, we fight not for our bottom line and livelihood, but rather for the common good, for our profession, and most importantly, for our patients. Today, we have the opportunity to enter this fight by passing House Bill 465 and Senate Bill 652 to begin the process to reform PBMs. We must end their unethical business practices, as 29 states already have, and 13 additional states, including Illinois, have joined in the fight. We already have federal legislation passed last year, and we must continue that fight at our state level. Let it be known, on this date, we enter a new era of pharmacy in this great state of Illinois, one that is not shadowed by the scrutiny of pharmacy benefit managers suppressing our true abilities, but rather one that is free to grow and thrive in the best ways our profession can. House Bill 465 and Senate Bill 652 lays the long-awaited groundwork to regulate and add transparency to the PBM industry. It provides real oversight of a business practice that has operated in the shadows for far too long. House Bill 465 and Senate Bill 652 is the first step of many more to come to usher in an era of increased pharmacy services, lowering cost of prescriptions, and rightful accessibility to our patients. We cannot allow PBMs to continue to hold our patients hostage from receiving the best care available from our very own pharmacists. House Bill 465 and Senate Bill 652 starts that journey today. However, be assured, this is not a sprint, this is a marathon. This will be a journey not accomplished with one bill, but many. This effort will not be easy. We must not enter this fight alone, but rather as one single voice of the entire community of pharmacists, standing together, working together to cross the finish line. If the conclusion of this fight yields prosperity and wealth, but leaves our citizens and patients without affordable access to prescription medications, then we will have failed as a state and a profession to care for our communities. So let us not fail now. Let us succeed. Let us provide the care that we are capable of. We ask for reform for the health of this great state. We can do better. We will do better. The future is before us, and we ask it starts now. Please pass House Bill 465 and Senate Bill 652. Thank you.
We've also been joined by Representative Dan Calkins and Thaddeus Jones. Thank you very much for being here and helping support our cause. Now I'd like to ask Lauren Young to please come forward, representing the Pharmacists United for Truth and Transparency.
Hi everyone, my name is Lauren Young and I'm a second-generation multi-store pharmacy owner right here in Illinois. My father, Dale Coley, started his pharmacy career over 50 years ago right here in Springfield at Everly's Drugstore, and he continues to practice in our stores located in Decatur and Forsyth, Illinois. We're here today to ask the Illinois State Legislature to please do, as Representative Harris and Senator Manar have stated, to regulate PBMs. Today, more than 400 current and future pharmacists from across the state have taken time away to make a single statement to the state of Illinois. Pharmacy Benefit Managers, or PBM, fraud, waste, and abuse can no longer be tolerated by Illinois taxpayers. PBMs cannot continue to take grotesque profits over and above prescription drug costs in our state. We have pharmacies located in Senator Manar's district and Representative Dan Calkins, and we're so thankful for their support today. The PBM opposition is alleging transparency will cost patients and taxpayers more and trying to represent the true state of affairs here in prescription drug pricing. Neighborhood pharmacies are not the greedy bad guys. We want everyone to know a few things about what's going on in our state. Current state law does not require PBM middlemen to be licensed. They are not regulated or held to an account by any government entity. We're calling on the state to license and regulate these PBM middlemen. Otherwise, Illinois' patients, taxpayers, and pharmacists will continue to pay high drug prices, and fraud, waste, and abuse will run rampant. PBM claims that they're regulated by the Illinois Department of Insurance, but they're not required to submit any filings with the Network Advocacy or Transparency Act. They also couldn't tell the House Prescription, Drug, and Insurance Committees when they were last audited by the state, as recently as March 1st of this year. Everyone in this room knows the last time they were audited, though, if you're an independent pharmacy owner. PBMs design and price prescription drug benefit plans, collecting and keeping manufacturer rebates instead of passing them on to patients. They calculate and control pharmacy reimbursement policies. PBMs want you to believe that a state law requiring them to operate more transparently will drive up prices. Think about that for a minute. The more transparency involved in drug pricing will raise prices? Not true. That is just not true. How is that possible? Taxpayers and lawmakers should be suspicious of these claims. We, pharmacists of Central Illinois and across the state, have long been suspicious of PBM claims of price savings, so we commissioned a report. We compared our real-time prescription claims to publicly reported data and discovered the following facts. Illinois pharmacies are paid $1.39 per prescription dispensed under the state's Medicaid program, but the PBM middlemen pay themselves $2.43 per prescription, or almost twice as much as your average independent pharmacy. Keep in mind the $1.39 is meant to cover the cost of the prescription bottle, the bag, the label, and all the other costs, including a professional pharmacy dispensing fee. I know my time's worth a lot more than $1.39. How about yours? The PBM only processes the claim and then arbitrarily imposes an alphabet soup full of DIR fees, including GER, which is generic effective rate, or brand effective rate, including a multitude of others that they just tack on whenever they want to, and it can be months after the prescription was covered at the pharmacy. With the assistance of this independent review, Illinois pharmacists determined the state can save at least $108 million annually by moving its employee health, workers' compensation, and I know this is something near and dear to Senator Manar's heart, teachers' retirement programs, away from the current opaque PBM model to a transparent, pass-through pharmacy benefit model. We're releasing our spread pricing report today and invite you to talk to our report spokesperson, Monique Whitney. She'll raise her hand, or you can find pharmacist Owen Sullivan, and they can give you a copy of the report and ask for any questions about the information contained. Now, the PBM opposition says that the practice of exorbitant spread pricing is misguided. It is not just unique to PBM contracts, but it's the exorbitant nature of spread pricing involved with prescription drugs that is the issue at hand here. Problem with spread pricing is it misrepresents the true cost of medications. If a drug costs $10 to acquire, but the payer believes it's $300, it's so inflated there's no relationship to that true price. Each provider in the chain of drug distribution deserves to be compensated. How much is too much is the question that we need to focus on today. Lastly, the most disturbing claim is that independent pharmacies are greedy and lying about how much we're reimbursed by PBMs. In Illinois, 15 pharmacies have closed in the last 12 months. Many more have been pushed to the brink of closure by forces beyond our control directly related to PBMs, including below-cost reimbursement, excessive fees, restricted networks, and steering patients to specialty or mail-order pharmacies. Neighborhood pharmacies can compete in a fair market, but our market is broken. Pharmacies are forced to accept payments that are below their costs, and we're subsidizing this healthcare system. When 70% of our prescriptions we dispense are paid below cost, the business model is unsustainable. This is the case for a lot of local pharmacies, especially in small-town neighborhood operations, grocery store pharmacies, and regional chains. And it just so happens the largest retail pharmacy in the country, CVS, owns one of the largest PBMs in the country. This is the mother of all conflict of interest, and CVS is not the only PBM to own pharmacies and have restricted networks and force people to mail order or special order pharmacies. It is for all these reasons we're here today. We support legislation that will protect and not overcharge Illinois consumers and taxpayers. Pharmacists have a professional responsibility to provide care for their patients. We are the frontline patient advocates for many people in our communities and state. PBMs are for-profit business. Licensing and regulating PBMs is an urgently needed message that will ensure Illinois patients and taxpayers have access to the true cost of their medications. Pharmacists will not rest until PBM regulation is a reality, and we're so thankful to our legislators in their support today. Thank you.
And our last speaker from the AIDS Foundation of Chicago is Maria Belfi.
Good afternoon. I am Maria Belfi. I'm a wife, mother, daughter, sister, aunt, author, seamstress, and friend. I am a rare disease patient. I have cystic fibrosis. Cystic fibrosis is a genetic lung disease that is very complex. It mainly affects the respiratory and digestive systems. It's a buildup of mucus throughout the body that harvests infections and causes malabsorption. I was diagnosed with cystic fibrosis at 6 months of age, but due to a false positive test result, there was not a lot of information on my diagnosis. I was treated as a normal child when I got colds, and my pediatrician put me on my first medication to help me digest food and explained it would help me gain weight. I was malnourished most of my life with cystic fibrosis. I'm now told I should intake 3,000 to 3,500 calories a day to maintain my weight. Once I graduated 8th grade, my family was relocated due to my father's job. I grew up in Melrose Park, Illinois, and then we moved to Lindenhurst, where I met my primary care physician. He explained to me the severity of my illness and how I had to take the pancreas tablets. Otherwise, I was looking at getting a G tube, a feeding tube, to help me gain weight. Once I graduated, I learned more about my CF, and I moved out of my family's home. I started living life on the fast track, thinking I wouldn't have much time to live. The average lifespan in 2004 for a CF patient was 22 years old. Once I reached 22, I was married and divorced. I pursued some college classes. However, being told my life would be shortened, I gave up rather quickly on my dreams. I started looking into my illness, and when I saw that my quality of life was declining compared to my peers, I reached out to Northwestern Memorial Hospital. In 2007, I started a new journey into the unknown. I was 87 pounds at 22 years old. Northwestern's amazing CF care had helped me educate and nourish my development. I attended clinic every 3 months. Having CF, I have learned that having a cold can become dangerous. When I'm not feeling well, I put on oral antibiotics for weeks and steroids to help any infection brewing. If this action plan doesn't work, I am admitted for IV antibiotics for a week. I then go home with a PICC line, which is a central line that goes into my arm directly into my lungs. It is normally there for 2 weeks. There are cases when if a central line cannot be placed, a patient like me would have to stay in the hospital for the whole administration of 3 weeks. Up until 4 years ago, I was being hospitalized every 3 months and couldn't hold a job. One of my specialty medications changed that for me. I am now hospitalized once to twice a year. Vertex Pharmaceuticals came out with Orkambi, which helps the cell level of my mutation of cystic fibrosis. Cystic fibrosis has roughly 2,000 identified mutations. My mutation is 2 copies of double delta F508. Last year, another medication called Symdeko was released and replaced my need for Orkambi, but is still considered a specialty medication that I needed copay assistance for. I take 1,410 pills a month. I'm prescribed 25 medications. 7 medications help me breathe. 7 medications help me digest. The other 11 help aid various health ailments like sinusitis and cirrhosis of the liver. I am now on 4 specialty medications that are Tier 4 of my pharmacy benefit formulary. A Tier 4 medication is a $100 copay. Due to high costs with insurance, I applied for copay assistance. 3 medications came down to $15, while the 4th came down to $30. The difference of $325 is not applied to my deductible per month. Because of this difference, the copay accumulators are preventing me from reaching my deductibles, and my insurance plan is making an extra $3,900 a year. That is equivalent to 1 month's income for a family of 4. My other copays range between $15 to $30, not including the over-the-counter vitamins and supplements. As you can see, my total out-of-pocket to maintain my health monthly without copay assistance would roughly be $800. Though these medications have changed my quality of life, I still cannot work. Too young to retire, too sick to work. So with my time I do have, I have become an active advocate for my health and to help others. I spend my time researching and being the change I want to see in the world. I volunteer on cystic fibrosis projects and events. I'm the co-chair of the Illinois Rare Disease Commission, and as of last year, I became the Illinois Rare Action Network State Ambassador for the National Organization of Rare Disorders. I'm here today to help Leader Harris to help our struggling families that are financially incapable due to these copay assistance programs. These programs are making patients to choose life or death. Some patients cannot afford their medications and spread them out longer, and the effects are similar to them not taking them at all. I want to thank everyone who is supporting this issue in Illinois, and please reach out to your legislators, your pharmacies, and Leader Harris share your thoughts and concerns for this bill. Thank you.
Thank you, everyone. And again, we do want to regulate PBMs, and we need PBM reform now. Again, these are the new steps, and we thank you very much for being here today. Thank you.
Thank you for watching the Illinois Channel. You may also wish to follow us online, where you are free to make comments or program suggestions. Get our breaking news updates on Twitter, where you can find us at Illinois Channel. You can find our past programming on YouTube at youtube.com/Illinois Channel TV. Or you can go to the Illinois Channel website at illinoischannel.org. There you can find not only our current video stories and programs, but also our library of past programs, as well as articles that provide additional information about Illinois issues and individuals. The Illinois Channel, keeping you connected to your state, your issues, your home.